When I was in the Army, I actually had injury early on. I wasn't aware of what was the cause. Even sheets on the bed at night were causing me pain in my feet. Marching was okay, but then I ran into a concrete step during one of the exercises. At that point, I ended up on crutches. The podiatrist said, "Well, first of all, Private, are these your boots? You're actually wearing the wrong size boots," and had been since basic training. I couldn't go to airborne training. My foot hurt too bad. There was no way I was going to make it through the training, so I had to change my MOS. After I got out of the military, I was looking for a career. While working in the government contractor position, I realized that I was having difficulty trying to manage my health care. I was looking for some specialty care for my long-term issues with my feet and my sinuses. I thought, can the VA help me with this? After my at-home sleep test, I sat down with the doctor and I realized I had no idea how serious it was, just not getting enough sleep. It wasn't only affecting my mind when my brain wasn't getting oxygen, but my mood. I would wake up cranky and then I would be rushed. It actually directed how my day was going, even my relationship with my spouse. Whole health not only got me more mindful of what direction I was headed and where I was going, but it also pointed out where I would be if I didn't take the necessary steps. Whole health got me moving again, and that's key. I wake up enthusiastic for the day. I actually am rejuvenated. I can jump out of bed and I'm already set and ready to go for the day. I was working with the VA. I've even gained a community there. I have a nutritionist who I can text if need be. She's there to help me, encourage me. And in our last conversation, start small. Focus on 2 items, not overwhelming items. The sleep therapist has helped me set a regimen for sleeping. And if I need to, I can reach out through secure messaging. Working with physical therapists in pain management to deflect from the pain. Acupuncture and other services has greatly improved my sinuses and my pain, and they can address whatever areas I'm having issues with. Part of whole health is mindfulness, being mindful, not only with your eating, but your environment, with your family, your community. I use nature in particular for my mental health. It actually calms me, it brings me back, connects me with the earth. It not only is good for the vitamins and nurturing your body, but it also is good for your mental health. All these items are preventing me from having to use narcotics. Whole health didn't help me just with sleep. It helped me as a whole. My eating, my sleeping, my mental health, my physical health. All of these things were amazing to me. For other veterans who may be as confused as me, you can talk to that primary care, explain to them what's going on, and they can lead you into whole health. You're not a number on a scale. There's something going on. A lot of times there's issues behind that. There could be triggers that a psychologist can help you with, a nutritionist can help you with. Maybe the MOVE program is right for you. In dealing with whole health, I learned a lot. I wasn't aware of the tools that were available to me. There are programs like this that can really help you, and I have to say it's changed my life, and I hope it changes yours.